Thank you. I have my cue to go ahead and get started. So, I'm just going to start out by sharing a video of one of our roots first mamas that we worked with. So, if you just give me a moment, let me just get my screen ready for you all.
When I had Marissa, it was like the best feeling and the worst feeling all at the same time. The birthing part was not so fun, but once she was born, that all went away. And it's just like light came into the world in my life for the first time. So when I had my third child and I suffered from postpartum depression, it was different than any depression I've ever felt before. I cried so much, and I'm not really a crier, and I hate the vulnerable feeling, but I cried all the time. For me, Our Roots was a lifesaver and a lifeline that helped me through a time when I felt like I had no one or nothing. To have someone support me who I felt I could connect with on a personal and cultural level was everything. Ever since Our Roots, I'm able to be there for my kids and enjoy them and be the mother that they deserve.
Wonderful. Thank you so much for listening. I'm Priya Iyer. I'm the founder and CEO of Our Roots, and I'm really excited to be here today and to be able to share more about our work and connect with you all hopefully after, as well as talk through any questions that you have about our work. Let me go ahead and share my screen one more time. Give me a moment, please. Okay. Here we go. Hopefully, you all can see my screen. Um, all right. So, as I mentioned, Angel was one of the very first community members that we worked with. And I think that she really exemplifies one of the many ways that Our Roots has worked with and supported our community members. Angel had many aspirations when she joined us. One of those was to go back to school and get a degree in psychology. She'd overcome a lot by the time she had her third child. And she knew that she wanted to become a peer coach. And so she recently got back in touch with me and told me that she's really excited about finishing this degree and actually wants to come back and work at Our Roots. This is really wonderful for us, and I think really shows the power and aspirations of not only Angel, but several of our mamas and birthing parents. It shows really how having, even one support person during this really transformative perinatal journey can shift the trajectory of someone's journey. So let me just take a step back and share with you what Our Roots is. So, Our Roots virtually connects birthing parents and mothers with peer coaches to promote healing, to prevent anxiety and depression. And I come to this work as a mother myself to two little ones, the daughter of immigrants, and someone who's experienced some of the same struggles that my community members have. So I hold this work really closely to my heart, which is why I do this. But I also want to talk about kind of why we need to be doing more of this work on a macro level, right? So we know that birthing parents of color in the US are twice as likely to experience perinatal mood and anxiety disorders compared to the general population. And I believe that one of the reasons this problem exists is because we offer one size fits all mental health care during this time period. We know that there are more than 1 million BIPOC birthing parents on Medicaid or who are uninsured. And we also know that this has a huge cost on our society, right? So every year, untreated perinatal mood disorders cost us $14 billion. So that's $32,000 per mother baby pair. And this doesn't just affect mama and baby. We have really good research to show that this can affect up to 3 generations. And I'm happy to share kind of some of these research studies afterward with you all for folks who are interested. But I want to make sure to emphasize that this conversation and these statistics on maternal mental health care are not separate from our conversation on maternal health, maternal justice, maternal equity, right? They're overlapping in so many ways. So, just to give you one example, a mama who experiences racism over a long period of time can accumulate stress in the body, and this leads to poor outcomes during her birth and postpartum. So, first, just reiterating that the two, maternal mental health and maternal health, are intertwined in so many ways. And second, I just want to emphasize this so that you can understand why we center who we center. So, our work is accessible to anyone. However, we know that Black and Indigenous women are more than 3 times as likely to experience maternal death as compared to their counterparts, which is absolutely unacceptable, right? And we also know that there are disparities that are smaller that exist in Pacific Islander communities and some Latinx communities as well. And more recently, research shows pretty drastic racial and ethnic disparities across all women of color, Latinx, Black, Asian, and Indigenous, for severe maternal morbidity. So I think it's important to hold all of these statistics and understand them. As we work to eliminate these challenges, we also want to center this idea that our communities, all communities, really deserve to experience joy during this process. And we don't really talk about that often in the design of our systems, but that's something that we think about at our roots in everything that we design. And this is during the perinatal period and beyond. And we really also want to ensure that people can access support that elevates instead of erases their cultural practices. So, how do we do all of this? Well, we really start out by building partnerships, and we do this thoughtfully. We build partnerships with federally qualified health centers, we build partnerships with larger community based organizations, as well as Medicaid managed care plans. So, we work with our points of contact at our partner organizations, and we try to build really simple workflows with them that allow for referrals. And then the birthing parent who's attending the FQHC or the community based org learns about our service and can decide to opt in and share their information. And then one of our peer coaches will reach out over text to start the engagement process. So then a person is matched with a peer coach who shares their language. And if that mama or birthing parent wants someone who shares their culture and identities, and I just want to pause here for a second and come back to this idea that we're virtual because we often get a lot of questions about that, right? We're building a relationship. Oftentimes people think of that as happening in person. But we find that the virtual component of our work is really, really critical. So, why is this? We've heard from many community members that it's really challenging to get to another appointment. For folks who have gone through the prenatal period themselves, you know how many appointments you have to get to. And the same with postpartum, when you're sleep deprived, and you are trying to manage a newborn, and you have so many other things going on. And so people really appreciate and have asked for virtual care. The other thing that we see arise a lot are sensitive situations, such as when folks are in domestic violence situations, and it becomes much easier to meet with us virtually and discreetly in that way. So this virtual care actually allows for a lot of flexibility, and we found that it works really well with our community members. So after folks are matched with a peer coach, they log onto our platform over the course of 12 check-ins with the peer coach, who they meet one-to-one with every week. And then soon, we're also thinking about expanding our offering to do small group check ins, because we've had a lot of mamas come to us saying that they are experiencing loneliness and are feeling isolated. And they really want to be able to connect with other mamas and birthing parents, in addition to having this one to one peer support. So we're excited to expand to that soon. And then the last piece is that the peer coaches at the beginning will screen for anxiety and depression. They help mamas set goals, and then they tailor resources to community members. So I'll dig into each of those a little bit more. The first is when we do screeners, we really try to center accessibility. We've noticed that the language in the screeners often is confusing to folks, so we really try to explain it to people so that they're clear on what they're answering. We have noticed, that they can often feel very sterile. And I'm so sorry, there's an ambulance going by me, so I'm just gonna pause for a second. Okay, sorry about that. Hopefully, y'all can still hear me. But we've just noticed that if any of you have done a screener before, that they can often feel very sterile, and having somebody walk you through and really explain that they're doing it for the intention of supporting you is really critical. And so we try to take that lens as we do both the Edinburgh postpartum screen as well as the GAD7 anxiety screener. Then we set goals with folks. So some of our community members have never been asked before, what are your goals? And so we allow those to emerge over the check-ins if folks don't explicitly articulate that at the beginning. And finally, we tailor resources to people. So for our peer coaches, we've worked on building out a chatbot that allows them to access a resource database that we've built up over the time that have culturally relevant resources that they can quickly access during the check-ins that they're doing, or even after the check-ins that they can share with our mothers. I wanted to take a few minutes also to emphasize some of the things that we center as we do the work. And there are three things. So that's being preventative, it's being culturally reverent, and it's being radically accessible. And I've touched on these things, but I'm just going to explicitly talk about them because they're so core to our work. So, when I talk about being preventative, one of the things that we've done is as we build partnerships, we ask folks to refer people to us regardless of if they have any kind of diagnosis. So, the number one reason for this is that we've found many times people are misdiagnosed or underdiagnosed in the community, but they still need the care. And we want them to still be able to opt in to access it. People come to us through many different pathways, and we found that health clinics use us in multiple different ways. So I'll just touch on a couple of those. One is that folks, many times in the federally qualified health centers we work in, there are long wait lists to therapists because of big shortages, right? And so folks come to us in the intermediary for support, knowing that we ourselves are not licensed therapists, but that they can have some form of support until they can get into a therapist. We've noticed folks come in when they're feeling stressed. They may never have a diagnosis. That's okay, but they need that support because they may not have any other support people around them in that moment. We've noticed that folks will come to us when they feel stigma around accessing mental health care, whereas it can feel a lot safer to work with a peer coach for some people. And then we've also noticed that sometimes people are already seeing a therapist, but they also want a peer coach who shares some lived experiences with them to talk through a different set of things. So those are some of the ways that people will come to us. Second, I want to come back to this idea of being culturally reverent. So this is really important to us, and it really comes through with the peer coaches and the way that we work with them. So all of our peer coaches share lived experiences and understanding of our community members, and we ensure that we're equitably paying, or more than equitably paying, our peer coaches for the hard work that they are doing. And in addition to that, we offer ongoing training for our peer coaches in how to uplift culture and support folks in incorporating this into their perinatal journey. We also offer ongoing training as a tool for professional development for our peer coaches. And then finally, I mentioned that we're radically accessible. So when I say that, I mean that we are accessible to anybody who has a smartphone, which is most of our community members. We're free to our mothers and birthing parents, and we try to maintain no wait list so that if somebody needs support, they're able to access it right away. So I wanted to touch on the impact that we've had so far. So in our pilots, we were able to show that we could have a drop in depression and anxiety scores of 70%. So when we looked at the average depression score that our birthing parents began with, it was 15, which is moderately severe depression. And then upon completion of the program, they were at a 5, which is mild depression. With anxiety, folks started with a score of 10, which is moderate anxiety. And then upon completion, they were at 3, which is minimal anxiety. We also saw that upon sign up, about 5% of people said that they can apply the knowledge and skills to manage their stress during the perinatal period. And then more than 85% after completion said the same. We have about 40% engagement rates at this point, which is fairly high. And that means that somebody actually signs up for a service and completes the first check-in with the peer coach. And then 100% of the people that we work with are either on Medicaid or uninsured. And as important to me as all of that quantitative data I shared are the stories of our mamas and birthing parents of how our program impacts them, right? So one of our mamas here said the exercises really helped to keep me grounded. And this mama in particular had experienced miscarriage right before her third pregnancy and was struggling a lot with her provider at the clinic at that time. Another mama says, "You helped me not feel alone when I felt like I was drowning postpartum." And then our first FQHC that we ever partnered with, Tiburcio Vasquez, said clients reported feeling heard and understood. And again, we really value these stories and testimonials from our partners and our community members. And just quickly touch on who our board is. We're small but mighty. We have Awara, who is a seed investor in birth equity and a doula. Irasma, who's a founder of the Power of Two, which is a fairly large nonprofit in New York City. And collectively, they bring a lot of experience in business development, partnerships, founding companies, birth equity, and so on. And then we also have several wonderful advisors, people with expertise, or a licensed therapist, people with expertise in product and tech, as well as Medicaid plans, so that we're able to navigate the many aspects of our work with a lot of thoughtfulness. And then I myself am a maternal and child health epidemiologist, and I've been working in this space for almost 20 years now. And So most importantly, with all that said, we, and I've actually calculated this, bring a lot of lived experience to this challenge that we're trying to eliminate. So collectively, we have changed more than 17,000 diapers and fed a baby more than 13,000 times. So we really deeply live and understand kind of what we're trying to get at. These are some of our partners, and I want to mention that right now we do all of our work in the East Bay in California. And so that's primarily Oakland as well as all of the surrounding areas. We're lucky to be able to work in many, many diverse communities. We partner with 3 federally qualified health centers, a large community based org, as well as a Medicaid managed care plan. And I'll just quickly touch on all of the wonderful funding partners we have that have offered us and invested in us for multiple years, allowing us to start thinking about now how we can expand this work outside of California and beyond. So we've been exploring potential partnerships in New York, in Louisiana, actually, where I am right now, and other places. And I would love to connect with anyone here around, any curiosities you have around our programming, any potential partnerships or anything else. So I'm excited to just pause here and see what questions folks have. And I haven't been able to see the chat. So let me just stop sharing my screen and then see if I've missed anything. Okay. And if you have other questions, feel free to chat them here. And again, if you don't have a burning question at this moment, feel free to also email me if you'd like to connect. I'll just repeat my email again. It's Priya, Priya, at ourroots.community. So Clarissa asks, do you provide any training for the 4th trimester for primary care providers? So at this point, we don't directly train primary care providers at the clinic itself. We have gone in and presented to our clinics before so that they have some awareness of what we're doing and a sense of our offering. And we are like happy to further develop that out with clinics that are in partnerships with us for sure, because we have gotten some requests around that. I'm just going to pause for a second to see if folks have any other questions. Feel free to pop anything that's coming up into the chat. Okay. Well, I don't see anything else. So thank you all so much for listening. And again, very happy to connect with you all offline. But I appreciate you being here, taking some time to learn a little bit more about maternal equity and our roots and how we might be able to bring that to FQHCs and beyond.